Happy New Year. You have Dalia Al-Kilani today with you on our first session in this year, 2021. Today we have Dr. Jose Manuel, who's gonna talk about the hands, wrist, and finger problems, the issues that's causing it, and how can we avoid it and the treatment. Please, I encourage you to send us your live questions and I'll be more than happy to pass it to the doctor to answer them. Dr. Jose, Happy New Year.
Happy New Year.
How's everything? All healthy and good?
All good. All
Very
good.
good. Okay, Dr. Jose, we have now the topic that we are raising today is about wrist, hand, and fingers problem, right? Could you tell us more about the symptoms and how would we know that we have a problem and whether it's a minor problem, major problem, and take us through this journey?
Okay. Well, I think that one of the most frequent things we see as hand surgeons are problems derived from overuse, either from work or in this time where COVID is so prevalent. Lots of people do many homework, many things at home that overuse their hands. And we're having a lot of consultations because of minor issues, because they don't need operations or anything, but they are overloads. You got simple things like tendinitis, where you have tendons that have been overstrained by repetitive use, either keyboarding or lifting things to arrange the stuff at home, or just due to a lot of work that they do, telematically with computers and stuff from home. So this is bringing us a lot of people in with tendinitis from overuse, just simple overloads, and of course we got a lot of consultations from sports injuries. Yes, fortunately, even though we got all these COVID restrictions, people are able to go and enjoy a little bit. The weather now is amazing in Dubai, so it's time for playing some sports, and proper technique is one of the most important things that people should underline for avoiding having injuries that we see a lot in the clinic, which include, of course, the overload from the exercise itself, which can happen to anyone, but highly trained people or people are starting. But in people that are not professional, we see a lot of deficiencies in their technique that are overloading parts of the body, and that possibly with a proper trainer or advisor, they could be avoiding them. That way they would be sparing a visit to the doctor, like a hand surgeon like me.
Doctor, do you receive patients who are like children getting those pains, or it's only the elder people?
Children, you know what, they're less prone to this kind of overuse injuries, but they tend to fall a lot, and now in a confined space like COVID, they tend to hit everything there is in a house. I mean, we see that a lot as well.
I see that a lot at home.
So that's a kind of problem. I mean, problem. It's normally a minor problem. It's not like being hit by a car, but we see a lot of injuries in kids by hitting things that are common at home from their activity. They want to do a lot. I mean, they're kids, and they end up hitting some stuff at home.
But is it just injuring the hand, or it's something that could be beneath the skin that we don't see, that could cause issues that we're not aware of? So yes, I know that if I bump my wrist, I'll find a bruise, and if it's something very critical, I'll go to the doctor. But things that I would wake up with it. And sometimes I wake up with a bruise and I don't know where it came from, or just pain in my wrist or fingers, or numbness, especially when I'm sleeping. And this is a question that actually we received from the audience, is numbness during sleeping.
Yeah, I mean, that's another different, let's say, category of problems that we see a lot. And that's not only linked with age. With the process of aging, there are some nerves that tend to get entrapped in some parts of the body. And I say throughout the process of aging, because it's very rare to see it in kids. And even though technically speaking, if there's another hand surgeon listening to this, he'll say, no, the truth is that we don't really know why it starts. It's true. We don't really know why it starts, but we don't see it in kids age 4, 6, 8. So I'm just, making a little of a summary to understand that yes, when we go over a certain age, call it 25, 35, and the closer we're to 60, 70, we see a lot of these problems you're mentioning. Problems when you sleep, and numbness, and especially in these three fingers is the most common part of the hand in which people wake up having numbness in the fingertips.
Yes.
Very annoying, and I can tell you not only because I work in this field, it's because I also had it in my own body. I mean, both of my hands, I have suffered carpal tunnel syndrome, which is the technical term for this kind of numbness. Again, I'm going to say it a bit slower. Carpal tunnel syndrome, because
that's exactly what I'm about to ask. Carpal tunnel symptoms.
Yes, I mean there's an actual tunnel here.
Yeah.
In the carpal area, which is these are the carpal bones, and through that carpal tunnel there are nerves which are like cables going to give you sensitivity in the fingertips, and at this level is where they get compressed, and people come in and ask us why is this happening, and it's because the little nerve gets compressed. Yeah, that happens a lot. It's one of the other problems we see a lot.
And what would be the treatment in this case?
The first thing you need to try is to do what we call conservative treatment, which is super simple. It's about using some supports at night. We apply them for sleeping, and statistically speaking, 70% of the patients that use the supports, they don't need anything else. We normally also request for a nerve conducting study. That's a routine test we do because we divide this problem into three types: mild, moderate, and severe. And we don't want to miss the severe one, because severe cases, they need close monitoring by the doctor, because sometimes if it's not responding to simple things, we need to upgrade the treatment and go for surgery, because the nerve can get squeezed so badly that it can start dying, the nerve. And that's not good, because parts are dead, they're not reversible, and people lose sensitivity in the fingertips.
Yeah.
So one of the first thing we do is we request for a nerve conducting study. If you're a mild or moderate case, we chill out. I mean, we keep the follow-up, and we make sure that the person is hopefully doing better, but we don't need to rush into any more aggressive treatments. When it's severe, sometimes we need to go for surgery, because otherwise we know that the nerve is going to lose function irreversibly, and that's a pity,
And for the moderate to minor cases, do you recommend any special exercises that a person can do on a daily basis?
Well, it's more about avoiding positions in which the wrists are bent, because that's why we really apply those supports. When we sleep, we tend to do like this. I mean, even if it's inadvertently, because we are sleeping, and that's why we use the supports. But during the day, if you're typing, if you're using the hands in specific sports, it's better to try to correct the position so they're kind of like straight. Because if you play around doing sports in awkward positions of the wrists, yeah, you tend to have that numbness. So that's the only real thing that may work. Because other things like stretching, and I can tell you because I've tried them all: yoga, stretching, even doing different exercises in the gym. They have not proven to work, and I wish I could tell you that I've been the exception. I've tried them and it worked. I've tried the same, and they never worked with me. I was a moderate case, and for many years I used a simple support, and one day I got fed up, and I mean that's another reason for going for surgery. Surgery always has risks, so we always try to avoid it. But if you're mild or moderate, the patient is the one that chooses when to do an operation, and to take those risks that the operation has for the benefit of getting rid of that horrendous numbness that doesn't allow you to sleep well. That's what I did in my case. But I was 6 years using the supports and having a normal life until one day I thought it was ridiculously giving me troubles at night and stuff. And I decided to take those risks for the benefits. But the truth is that mild and moderate cases, they're managed with simple things, which are the support at night, and avoiding doing sports and activities in which you're super bent like this, because it gets otherwise so numb.
And what are those major cases that you will have to say, you know what, it's time for surgery?
Well, mild and moderate, as I was telling you before, it's you who chooses. I mean, there's a moment in which you may say, look, the supports, they are not working anymore, and the doctor might be telling me that it's not severe, so I can choose, but I'm sleeping so badly and so poorly that I want to take the risks for the benefits. The risks are not huge, but we are always concerned about the worst case scenario is bad. It's about cutting a nerve that gives the nerve that we want to save. The truth is that properly trained hand surgeons have that super rarely, and especially with the new techniques that we got now, in which we monitor in real time the nerve. Well, there are new things that we do in Medicare that fortunately reduce even further the risk. But it's true that we always try our best to avoid surgery. And if it's not possible because the life quality is too bad, then we take the risk for the benefit. Or if you get a severe case that is not being managed well with the support, because otherwise it's going to die. The nerve is going to get squeezed and it's going to get.
Doctor, we covered the kind of the treatment where you can do the supporter and avoid what we can avoid, but any medical treatment that you recommend or you put your patients on?
That's been extensively studied. Unfortunately, for the carpal tunnel, if the question is specifically for the carpal tunnel,
yes,
there are many medications that have been tried. Vitamin B, I could make a big list of things, but to make the story short, the American Academy of Orthopedic Surgery published a very good report in which they studied and they saw that none of the medication works. It may provide relief for a few hours, but their comprehensive study, they showed that, well, it doesn't harm you. You can try it, and I tried it for myself. I tried everything before doing surgery.
Even creams and applying like...
Yeah.
No.
You can try them. You can try them, and I'm never against it. My patients, when they ask me, I tell them, yeah, try, why not? But I've tried most of those treatments because it was 6 years with the carpal tunnel for myself, and it never worked. I mean, the only thing that worked were the simple things like not bending excessively the wrist and sleeping with the supports. But there's nothing against trying.
And what other, it's not symptoms, I would say, but what other things that you can get aside from carpal tunnel symptoms that is a little bit worrying?
In the hand?
Yeah.
Well, let's see. Of course, in people that practice, that are active or practice sports, the fractures are always a problem. Fractures and dislocations. Especially, there are very tough people that practice contact sports in which they hit something, they feel that something's popped out of place, and they pull it back either themselves or with a friend, with the help of a friend, and sometimes they come a few days or weeks later after trying their best to manage it on their own, and it's a mess. No, it's better to come and see the doctor because sometimes their efforts to put the joint back into place were not effective. It was out of the place. And that's not good. A dislocation has to be managed by a doctor because otherwise there's a risk of not ending up well. That's one of the many I could think. Fractures could be included in this story, but dislocations are even worse. They give a lot of stiffness, and that's something we see more often than we'd like to.
What are the major cases that you received in 2020? The common ones.
The most common things?
Yes.
Frankly speaking, the most common things, fortunately, are the easiest ones. I mean, things that you can help them easily with a splint or with some recommendations. For example, one super common that we see a lot is a trigger finger. A trigger finger is just a tendon coming we move the hands thanks to the fact that we got muscles here and they're connected with tendons that look like ropes, and they go all the way to the fingertips. At some point in this part of the hand, they may get stuck against a little tunnel, like the one I was talking about here, the carpal tunnel, but in miniature. And the fact that the tendon gets stuck against the rim of the tunnel produces a little clicking. That clicking is nothing dangerous. It's not like the carpal tunnel syndrome where you have to be taking care of the nerve just in case it dies. And here's the opposite. It's nothing dangerous, but it's something that happens a lot, and some people, they get scared because they see the finger doing click, 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 click. Easy to manage, nothing dangerous, but we see a lot. For example, that's a very common thing. Tendinitis, of course, as I told you before. And unfortunately, well, we also have big accidents, but those are not the most frequent things we see And one of the most frequent ones I see, there's a ligament here which is called the TFCC. Well, it's just an acronym. It's a technical term to just call to give a tag to the ligament here in exactly the spot that gets strained when you do bench press or when you play tennis. Tennis is very frequent. Or if you fell with the hand outstretched like this, you also may hurt it. And we see a lot of those. And they're easy to treat, especially if they come early. If they take many weeks, it's like spraining your ankle and not looking for help. Instead of having a couple of crutches and hopping around, if you don't look for medical help, you may induce a chronic injury that you could avoid easily by using a pair of crutches. Here you got the equivalent in the wrist, and it's very easy to treat if you see the doctor. That's another good example.
Good. Cracking fingers when you crack them.
Oh, that's a good question. There was a lot of controversy about that, but as if it was going to produce long-term any issues or not. And I've been checking the literature several times because my latest understanding is that it doesn't produce anything long-term, but that's what the literature says. But then I've seen many patients in the office that what happens to them is that they produce a sprain on a ligament, and they end up being with a tape and a splint for 3 weeks because they hurt a ligament. They do a sprain like the one I was talking about here, but in one of the knuckles. So even though long term is not being shown to produce any arthritis or any major stuff, short term we see a lot of people that get strained and then they end up having a splint for a few weeks. Yeah.
Okay. Before we end our session, Dr. Jose Manuel, he's a consultant orthopedic surgeon at Medcare Hospital. Any tips for 2021?
Well, be safe. My God. Apart from that, enjoy, because I think it's going to be. I hope it's going to be a great year, where vaccination is fortunately coming into our societies, and I hope this protection allows us to start enjoying life the way we should. We should have always been able to enjoy 2020, and it's never happened this way. But this year is going to be